All right. Wendy, would you mind introducing yourself and telling us why you sought the help of Dr. Kingsbury?
Yes, my name is Wendy Petrak, and I came to Dr. Kingsbury's office out of desperation. I think it was like my last straw. You know, I had been many years trying different forms of care to alleviate extreme pain caused by nerve damage in my shoulders. I have a bulging disc in my neck and bone spurs, and so I had all this pain. And after years of this pain that was never ending, I also got fibromyalgia, and so then I had even more pain. And after years of that pain and fibromyalgia, I was getting to the point where I felt like I would have to quit my job and go on disability. I was just so uncomfortable. I couldn't cope, and my head never felt good. I felt like I had brain fog and too much pain, and just was beginning to really shut down in every way, both emotionally and physically. So I heard about Dr. Kingsbury, what he does with the brain, and I don't know how to explain it, but with the help of my daughter, we signed up, and I started doing his protocol.
The neurofeedback?
Neurofeedback, that's what it is, neurofeedback, along with a little bit of physical therapy occasionally. And in the beginning, I felt like I was really fatigued, probably didn't really feel like, I wasn't sure if it was going to work. I felt tired after each session, and then after about maybe 4 or more sessions, I started to really feel a lot more comfortable, a lot more alive, a lot more hope. And I continued, and I thought, this is great, this is great. But then I also felt skeptical, I guess, because I really figured it would go away, that it would be a temporary fix, just like the acupuncture and the chiropractic and all the nutritional stuff I tried, and the pain management classes and the prednisone, and just years and years of many different types of ways trying to learn how to get the pain manageable. So I was told that it would be more than manageable, that it would go away, and it did. So I think I went through like 7 months or so, twice a week, sometimes 3 times a week, of his care, and it's been probably 6 or 7 months since I haven't come in, and I've continued to improve. I'm pain-free. I am pain-free. And yet nothing's changed. I mean, I never had any operations for the shoulders or the neck, the bulging disc, the fibromyalgia. It kind of acts up a little tiny bit, but it's not nearly what I used to be when I have a flare-up. I'm somewhat aware of some soreness in my joints, which is kind of common. I have arthritis, but everything is so much more manageable, and that nerve pain is gone, and that's what was really just it was really, my quality of life was very poor. So thank you, Dr. Kingsbury, so much, truly, and thank you, Nicole, my daughter, who helped me with this. So I really appreciate it.
That's wonderful.
And that's it. That's my story.
So you mentioned you also, in addition to the neurofeedback that really helps with training the brainwaves,
Yes.
you mentioned that you also received some physical therapy.
Yes.
From Dr. Kingsbury?
Yes.
Okay.
Yeah, a little bit. He would do a little bit of adjustments and work on getting this arm to, because I wasn't able to put it out to the side. I wasn't able to, meet up here or even do this without, a pinching and a pain. So he really would work on that a little bit, and it helped as well. But I would have to say that, I've been through years and years of physical therapy and chiropractic and stuff, so I don't think it would have worked without the neurofeedback. Honestly, I don't, because that seems to have what's done the trick. Retraining my brain, which is what they wanted to do in my classes at Kaiser, to retrain your brain, but it's a lot slower. I mean, I would have had to have been taking classes 6 to 8 hours a day for several months, and I have to work. I work full time. I work 2 jobs, so I couldn't. So I would go to half-hour classes once a week, and I was getting, wasn't really getting anywhere in that regard. So retraining the brain, I know they talked to me about it at Kaiser, but it wasn't something that was optimal for me.
For your schedule.
For my schedule, right.
Yeah. So this made it a lot more.
Yeah, it was faster. It was definitely faster, much faster, and much improvement in a short amount of time.
Great. Okay. And so you mentioned a little bit about how relieved you feel from the pain and how things are a little bit better for you. What other differences have you noticed? Have you experienced a sense, really completing care?
Well, like I said, I was at a point where I thought I would have to go on disability and quit my job. And now I do. I'm physically active. I'm exercising. I go motorcycle riding, which I love. And I could never have done that with, the shape I was in because of pain. And I'm pain-free. And I continue to be pain-free, even though we've dumped the bike twice. So, I've actually been hard on my body, really hard on my body. And I'm able to be hard on my body. I feel years younger, years and years and years younger. And I'm enjoying life really to the fullest extent for the first time in it was over 15 years ago when I first started. So I'm just so grateful to have this time where I can really enjoy myself and I can do all the things that I really couldn't do. And simple things. I couldn't vacuum. I couldn't do lifting, like the cat food and stuff like that without pain, bringing in groceries. It would set me back for days. I'd be on ice. I'd be on heat. I'd be trying to take something for pain. I don't take anything. I'm not on any medications. And I do a lot of things that I thought I would never do. So that's been the big difference. Quality of life has been amazing.
Great. Well, thank you so much for sharing your experience, Wendy.
Thank you. Thank you, the doctor, for me. He's so great. I'm very pleased.
Thank you.